If you're over 70, you've probably heard the same message again and again. Stay on top of your health. Don't skip your checkups. Catch problems early. And on the surface, that advice makes sense. You show up to appointments, you agree to the tests, and you trust that more information automatically means more safety. But here's something most seniors are never clearly told. Some routine medical tests, especially after age 70, don't actually protect you. In fact, certain checkups can quietly increase your chances of unnecessary treatments, long-term side effects, and even serious complications that change your quality of life. This isn't about avoiding doctors or ignoring symptoms. It's about understanding that more testing does not always equal better health, particularly later in life. Every year, millions of older adults line up for medical screenings, believing they're doing the responsible thing. Yet studies now show that up to 37% of medical tests in seniors lead to unnecessary treatments, complications, or lifelong side effects. Even more concerning, nearly 99% of people over 70 don't realize they may be over-tested. That gap in understanding matters, because once a test finds something, even something harmless, it often sets off a chain reaction that's very hard to stop. Today, we're going to walk through this carefully and calmly. No scare tactics, no hype, just real science, real examples, and clear explanations. These are 5 health checkups that often cause more harm than good after age 70. And why knowing this can help you protect not just your health, but your independence, your energy, and your peace of mind. Before we go further, I want to pause for a moment. If you're watching this, you're already being thoughtful about your health, and that matters. And I'd really like to know where you're watching from, your age, and whether you've ever had a test or procedure that you later felt wasn't truly necessary. Many people have, and sharing experiences helps others feel less alone. Now let's start with a test that almost everyone assumes is harmless. A bone density scan sounds simple and reassuring. It's quick, painless, and doesn't involve needles or sedation. You lie down, the machine scans your bones, and you leave with a number that's supposed to tell you how strong your bones are and how likely you are to fracture. On paper, that sounds helpful. But after age 70, bone density scans often create more fear than benefit. This test, officially called a DEXA scan, measures bone density and is mainly used to diagnose osteoporosis. The issue is that bone density naturally declines with age, especially in older adults and particularly in women. This is a normal biological process, not a disease in itself. Just like wrinkles, gray hair, or changes in muscle mass, bone loss happens to nearly everyone as they age. Because of that, DEXA scans in people over 70 almost always show lower bone density, even when there's no real danger of fracture. But once that result appears on paper, it often leads to medication. Many seniors are quickly prescribed drugs called bisphosphonates, which are designed to slow bone breakdown. These medications are often presented as protective and preventive. What's discussed far less clearly are the risks. Bisphosphonates are linked to serious side effects. One of the most concerning is jawbone necrosis, a rare but severe condition where the jawbone begins to deteriorate. They're also associated with esophageal irritation, digestive problems, inflammation, and in some cases, brittle bones that fracture in unusual ways. Now here's the key question. Do these medications actually prevent fractures in people over 70? The answer, according to the data, is not very much. A study published in the Journal of the American Geriatric Society followed more than 1,200 women over age 70. After 5 years of treatment with bisphosphonates, fracture risk was reduced by only 0.3%. That's not zero, but it's far from life-saving, especially when weighed against the likelihood of medication-related harm. To understand what this looks like in real life, consider Rose. Rose was a 76-year-old retired piano teacher. She walked every day, had never fallen, and had no bone pain. After a routine annual checkup, she was referred for a DEXA scan. The results showed osteopenia, which is a mild reduction in bone density and not considered osteoporosis. Despite that, she was immediately started on a bisphosphonate medication. Within 3 months, Rose developed severe acid reflux and jaw pain. She stopped playing piano because of the discomfort. By the time she sought further help, her quality of life had noticeably declined. Her care plan changed. She stopped the medication and instead focused on vitamin D, weight-bearing exercises using resistance bands, and a calcium-rich diet that included foods like sardines and leafy greens. 1 year later, she had stronger legs, better balance, and 0 fractures. She was back to performing recitals and enjoying daily movement. Research supports this approach. According to a 2022 study in Osteoporosis International, lifestyle measures such as strength training, balance exercises, proper nutrition, and correcting vitamin D deficiency can reduce fracture risk by over 20%. That's significantly more than the benefit seen from medication in this age group. So here's the simple takeaway. For people over 70 who aren't falling or breaking bones, a bone density number alone shouldn't scare you into treatment you may not need. Now let's move on to a scan that causes even more anxiety. When memory slips happen, and they do happen with aging, it's easy for fear to take over. Forgetting names, misplacing keys, or feeling mentally slower can trigger immediate worries about dementia or Alzheimer's disease. Doctors often respond to that fear by ordering a brain MRI. It feels like a logical next step. Look inside the brain and see what's wrong. But in reality, brain MRIs rarely provide the reassurance people are hoping for. A brain MRI shows the structure of the brain in great detail. In adults over 70, most MRIs reveal age-related changes, such as mild brain shrinkage or small white matter spots. These findings are extremely common and often completely normal for older adults. The problem is what happens after those changes are seen. Once something appears on a scan, it can trigger a cascade of fear, more tests, specialist referrals, and sometimes even invasive procedures, despite the fact that memory often doesn't improve and may actually worsen due to stress. A 2021 review published in Neurology Today examined more than 3,000 brain MRIs in patients aged 70 to 85 who had mild cognitive complaints. That means 97% of patients experienced the emotional toll of being told something looked wrong when there was no actionable problem. Even more concerning, nearly 12% were sent for invasive procedures such as spinal taps or exploratory biopsies based on unclear MRI findings. George's story makes this real. George was a 74-year-old retired engineer who noticed mild forgetfulness. He misplaced his keys more often and occasionally forgot names. His doctor ordered an MRI, which showed white matter changes. George panicked. He became convinced he had dementia. He stopped driving. He stopped attending church. His anxiety grew and his confidence dropped. When his cognitive function was later evaluated using a standard paper-based cognitive screening test, his results were well within the normal range. The MRI findings were explained as age-appropriate. George shifted his focus to better sleep, hydration, and simple brain exercises. Within 3 months, his memory stabilized and he felt like himself again. The truth is, unless someone has severe neurological symptoms, such as seizures, sudden personality changes, or rapid functional decline, a brain MRI is rarely helpful for mild memory concerns. A cognitive screening test is often a safer, simpler, and more appropriate first step. Now, with that in mind, let's talk about a test that many seniors have had multiple times. The cardiac stress test is one of the most common tests ordered for older adults who report fatigue, chest tightness, or just not feeling like they used to. During the test, heart function is monitored while walking on a treadmill or while medications simulate exercise. The goal is to detect blocked arteries. But after age 70, Cardiac stress tests often do more harm than good, especially when used in people without clear symptoms of heart disease. The main issue is accuracy. In adults over 70, the false positive rate of stress tests can be as high as 40%. That means the test frequently suggests there's a problem when there isn't one. These false alarms often lead to angiograms, stent placement, or even bypass surgery. A 2017 study in JAMA Cardiology found that more than half of stents placed after stress test referrals were done in patients without meaningful symptoms. Those patients saw no improvement in survival or quality of life. What they did experience were higher rates of bleeding, kidney injury from contrast dyes, and longer hospital stays. Raymond's experience illustrates this clearly. Raymond was a 75-year-old retired postman who stayed active by walking every day. During a routine checkup, he mentioned feeling tired when walking uphill. His doctor ordered a stress test just to be safe. The results were unclear, so Raymond was sent for a cardiac catheterization, a procedure where a tube is inserted into the arteries to look for blockages. A mild narrowing was found, and a stent was placed. That night, Raymond had a reaction to the contrast dye and developed kidney problems. He spent 6 days in the hospital and required weeks of follow-up care. His fatigue never improved because it wasn't caused by heart disease. He simply needed better hydration and more rest between meals. For people over 70 who aren't experiencing classic cardiac symptoms, such as chest pain during activity, shortness of breath on exertion, or a significant drop in energy during light exercise, a stress test may do more harm than good. Safer options often include a resting EKG, which evaluates heart rhythm while you're still, or a coronary calcium scan, a low-radiation imaging test that shows whether dangerous plaque is building up. Now let's talk about a test that surprises many people. A colonoscopy is not always a wise choice after age 70 and is almost never recommended after 75 unless specific symptoms are present. As people age, the risks associated with colonoscopy increase. The preparation involves strong laxatives that can cause dehydration, dizziness, and kidney problems. Sedation poses added risks to brain function. And the procedure itself can lead to bleeding, tearing, or heart rhythm disturbances. A 2019 study in JAMA Internal Medicine followed over 1.3 million Medicare patients aged 70 and older. For every 1,000 colonoscopies performed in patients over 75, 2 lives were saved, but more than 20 people experienced serious complications. That's a 10-to-1 risk-to-benefit ratio. Dana's story shows how this plays out. Dana was a 73-year-old grandmother who ran a small bakery with her daughter. She had no symptoms, no family history of colon cancer, and no changes in stool. Her new primary doctor urged her to have a screening colonoscopy. During the procedure, a small polyp was removed. That night, Dana experienced severe abdominal pain and fainted. At the hospital, doctors found a bowel perforation. She spent 9 days recovering, lost 10 pounds, and never fully returned to her previous energy level. When her medical history was reviewed, it turned out she had already had 2 clean colonoscopies in the past. There was no strong reason to repeat the test. The U.S. Preventive Services Task Force currently recommends stopping routine colon cancer screening at 75 for most people. For those in excellent health, a FIT stool test, done at home, is often a safer alternative. It requires no preparation, no sedation, and still detects most concerning cases. And now we reach the most overused and potentially dangerous test of all. Annual full-body CT scans are often marketed as preventative tools, sometimes offered in executive health packages or private clinics. They promise early cancer detection, but the reality is far more troubling. Each full-body CT scan exposes the body to 10 to 20 millisieverts of ionizing radiation, which is roughly equal to 500 chest X-rays. In older adults, especially over 70, the likelihood of triggering unnecessary follow-ups, biopsies, and surgeries is extremely high. A 2023 modeling study published in JAMA Internal Medicine suggests that the rise in CT scans may now be responsible for up to 5% of all cancers in the United States, putting them on par with alcohol as a cancer-causing factor. That means 1 out of every 20 cancers may be caused by a scan that was meant to prevent disease. Marcus's experience makes this painfully clear. Marcus was an active 80-year-old who felt healthy and strong. He participated in a private, elite health screening that included a full-body CT scan. The scan revealed a tiny 3-millimeter nodule. That small finding triggered a chain reaction. Marcus was referred to oncology, sent for a PET scan, and eventually underwent a needle biopsy. The biopsy came back benign, but it collapsed part of his lung. He was hospitalized and needed 2 months to recover. All of that stemmed from something that could have been safely left alone. Experts now agree that full-body CT scans should never be used for general screening in asymptomatic adults. The American College of Radiology is clear. There is no proven benefit and significant potential for harm. If there are symptoms such as unexplained weight loss, coughing up blood, or visible swelling, targeted imaging makes sense. But scanning the entire body without focus is like searching for treasure with a landmine detector. You may find something, but the damage can be worse than the problem you were trying to avoid. A safer approach is listening to your body, maintaining regular checkups with your primary doctor, and choosing tests that are clearly indicated. So what's the real lesson here? These 5 checkups often sound helpful, especially once you're past 70. But modern medicine, while powerful, is not perfect. Sometimes less really is more. Before agreeing to a test, ask one simple question. What happens next if this finds something? If the answer involves more invasive procedures, unclear benefits, or higher risks than rewards, it may be time to pause. Real prevention starts with lifestyle, staying active, eating well, sleeping deeply, staying socially connected, and protecting your peace of mind. Now I want to hear from you. Have you or someone you love ever gone through a medical test or treatment that caused complications or stress and later turned out to be unnecessary? What happened? Share your experience in the comments. Your story could help someone else make a more informed choice. Thank you for watching.